There is a growing incidence of coronary artery disease, cardiovascular disease all over the globe, but particularly in the third world countries and more so in South Asia. It is the number one cause of mortality and morbidity. With this rising numbers of patients, and the irony of our country is that we hear coronary artery disease affects younger and younger individuals. So heart attacks take place in people below 30, in people below 35, and that is like an epidemic engulfing our country. Also, you will see that there is a rising incidence of high blood pressure, high cholesterol levels, cigarette smoking is rampant, diabetes, we are already known as the diabetes capital of the world, and many of these risk factors, most of these risk factors actually contribute towards blockage of the arteries of the heart, which can cause angina, which can cause heart attacks, and 30% of people who get a heart attack never get a second chance to stand up and say, look, can you guys save me? Can you all save me? I'm having a chest pain. In this scenario, with the country facing an epidemic of cardiovascular disease, valvular heart disease, artery heart disease, congenital heart disease, rheumatic heart disease still continues to be there, I feel particularly, that there has to be a resurgence of clinical cardiology. There has to be a partnership between clinical cardiology, echocardiography, and acute care cardiology. If these three elements are together, we can preempt and prevent the disease, very important. And those who actually come down with a heart attack, then we can very quickly help them go to the cath lab for primary angioplasty, or give them clot buster drugs, or if they have severe disease, to actually get them to a bypass procedure. But this is clear that interventional procedures alone may not be sufficient to tide this crisis, the human crisis of premature coronary artery disease. And for that, several things are required, but amongst the most important to my mind is a young generation of millennials who actually will learn the nuance of preemption and prevention, and then be able to go to the public and take care of them. So Medvarsity and Medanta Heart Institute have clubbed together, have joined hands together to make a 2-year course on clinical, preventive and non-invasive cardiology. This is the first course of its kind in our part of the world. And this will not only help the patients for whom it is meant, but also will help the industry in a long way. So what are the qualifications? Anybody who's done MD in internal medicine or MD in family medicine or DNB, in this two years where the people will be actually working as like residents at the Medanta Heart Institute, they will be going through all the areas of clinical cardiology, preventive cardiology, and also acute care cardiology. They will undergo a thorough training in the complete nuance of echocardiography, for example, right from M mode to 2D to 3D echocardiography, intermedial thickness, pulse wave velocity, stress echocardiography, transesophageal echocardiography, dobutamine, so that they are well versed in the total nuance of clinical and non-invasive cardiology. They will also be rotated through our clinical wards and also the acute care cardiology, because when the acutely ill patients come in with acute heart attacks, they will know which drugs to use, what thrombolytics have to be used, what are the clot buster drugs, and when the patient has to be sent to the cath lab. So and of course, look after what is called as cardiogenic shock. So I think this 2-year course that they will spend at Medanta Heart Institute will go a long way in making them true clinical cardiologists with a strong points of acute care and also echocardiography. the course will be divided into 4 semesters, and the theory part and the practical part will go like hand in hand. So for example, in the first semester, one group will do coronary artery disease, then you will do valvular heart disease and heart failure. There's an epidemic of heart failure right now. And then cardiac emergencies, and of course the miscellaneous cardiac conditions. But not only will you get theoretical lectures on this, and you will also have to participate, the students will also have to participate in seminars, but simultaneously you will also be seeing patients, treating patients, so that theory and practice move at tandem, hand in hand, for a full knowledge. And you will see a complete nuance of cardiology as it unfolds in day-to-day life. Because in the 21st century, high blood pressure, diabetes, smoking, sedentary lifestyles, obesity, all these are becoming, and you will be able to spearhead in your own community, in your own settings, to take this forward. So I think a course like this actually doesn't really exist in the clinical setting anywhere. So you'll be a part of a journey which ultimately will help India and Indians.